I'm Dr. Brett Yoder. I'm a outpatient family medicine doctor at Cedar Knolls. Skin cancer basically is where any of the cells that are on the skin, they basically transform from something that's sort of benign or something that we don't worry about to something where you have unregulated growth. Unregulated growth leads to cancer. So what we want to look for is any asymmetry. So if it used to be circular and now it's not, it's more of an oval shape, or it looks like it's in two parts, we need to take a look at that. If there's any issues with the borders at all. So if it used to be sort of real smooth and now it's not, we need to see that in the office. Other ones would be if it's getting larger. It used to be really small and now it's getting increasingly larger, or if there's just a spot you're worried about. If it just doesn't look right to you, then we need to see it. We recommend that you do self-checks at least once a month. If you find something that's abnormal, go to your primary care doctor. We can take a look at it. In my clinic, we can remove most anything that isn't on the face. And otherwise, we'll get you to dermatology, and if it needs to come off, we'll take it off. Most susceptible areas are what the sun's seeing. So top of the head, if you're not wearing a hat or you haven't worn sunscreen for a long time, the top of the neck, shoulder areas, forearms, usually the front of the legs. If you're getting spots in between the fingers or in between the toes, those are areas that really don't get a lot of sun. And so if you're getting them there, we need to see those. You can do long sleeves. If you're out, if you're on the beach, make sure that you're using sunscreen. If you're going in the water, reapplying that every 2 hours. Making sure that you get it on the top of the ears, that's really prevalent area. And then reapplication's the biggest thing. So if you have any spot that worries you at all, go see your primary care doctor. If they cannot take care of it in the office, they'll get you to somebody that can. There's a bunch of specialists that we can send you to. Dermatology can get those removed if there's something that we think is abnormal, but you know your body best. So if you notice something, say something to your provider.